Welcome into this morning's edition of HealthWise, the TV show. I'm your host, Ralph Hipp. The joint pain that's caused by osteoarthritis can sometimes cause those affected to reduce their activity levels and become less mobile over time. We're going to talk about that today. Mike Conlin, you know him well as the owner of Jayhawk Pharmacy and Patient Supply. Mike is sharing more information how to reduce the pain of osteoarthritis, keep moving and enjoying an active life. Mike, you've actively made your way to our table, and it's good to see you again, sir.
Thanks for having me.
Well, I wanted to mention arthritis can affect young people as well.
Young as well as old.
And senior. And is there any differentiation? How does arthritis affect a person's mobility, and depending on what age they are?
With the pain, the inflammation, you lose mobility, you lose flexibility, and it a lot of times will cause people to become a little bit more sedentary. It's an inflammation of the joints generally, and can be treated with a variety of medications. You need to consult with your pharmacist or physician to self-medicate for those.
Would you like to add anything, Mike, some of the symptoms of osteoarthritis?
Well, the swelling, you can see it a lot in folks' joints, the achiness, difficulty in holding a pen, getting up and down, out of a chair, off of the red couch or something like that.
Anything like that.
Anything like that can be very uncomfortable. It can happen at a younger age or an older age. Most of us think of arthritis as a malady of an older individual, though.
Right. Does it come and go, or is it chronic? Is it usually all the time for them, Mike?
A lot of people will complain with changes in weather and barometric pressure that there'll be changes in their comfort level as well, but it's smoldering. That inflammation's always there. It's just trying to keep it in check.
So if we're afflicted with osteoarthritis, what are some of the lifestyle changes we could make to, put the odds in our favor a little bit more?
A lot of people are very reluctant to seek medical equipment. They would prefer to try and take a medication.
Or I'd like to try this on my own to make it go away.
Exactly. Yeah. And that's where you really want to be cognizant of the fact of the medicines that you are taking. Many medications can conflict with just over-the-counter medications that you can purchase now. There's so many medications years ago, even 5 years ago, you wouldn't have even thought to be able to be purchased without a prescription. And that conflict, that interaction can be a real problem. If, for example, you're on a blood thinner and you take an aspirin-based product or a non-steroidal anti-inflammatory like Motrin.
Right. Well, and certainly check with your family members about your medications, check with your doctor. On the other side, Mike Conlin, what are some of the mobility aids that are available out there to help us get around?
Bathroom safety is a big thing if you're having trouble with mobility. Just simple aids like grab bars to get in and out of the bathtub. There's different devices that will help you do that. Watch for throw rugs. Those are a real trip hazard for folks, particularly.
Get rid of those in the house or apartment? Just take those out.
Just take a mile-high evaluation of what, evaluation of your home and what could be an obstacle. Then when it comes to just out and about, there's canes, there's two-wheeled walkers, there's four-wheeled walkers called rollators. Interestingly, most insurances will allow a cane and then a two-wheeled walker and then a four-wheeled walker. They won't allow a four-wheeled walker, two-wheeled walker, and cane. So it's almost like it's a given that you will digress in your wellness, so to speak.
And another thing, Mike, they have to ask about. Well, this was covered, but this is not, and that may well be the case. Is it literally like a crutch to have some of these things? And do we really get independence from having these mobility aids, Mike, or does it make us feel better about trying to get around?
I would make the argument that it makes you feel better about getting around. There's nothing worse than sitting inside, kind of toiling and lamenting over not being able to go to bridge or go get your hair done or go to the grocery store, things of that nature.
So we do have more independence, though.
So it offers you the independence. It really does.
Right. Well, some of the aids, do we have to have a prescription for some of the things that we're talking about? A doctor's suggestion, at least.
Well, a doctor's suggestion, that becomes a difficult thing to deal with, because the doctor may say, well, you'll benefit from a walker. They may come to us then for a two-wheeled walker. But if we're going to bill their insurance, there's a laundry list of things that insurance requires. So our responsibility then is to gather that information on the patient's behalf.
Right. We're talking with the very familiar face, you know him well, Mike Conlin of Jayhawk Pharmacy and Patient Supply, discussing osteoarthritis. on HealthWise, the TV show. Well, what do you have over there? Can you give us, obviously not their cases or names, some of the things that people have come in for at Jayhawk Pharmacy and Patient Supply you've been able to equip them with?
Well, you think of osteoarthritis and you look at the diagnosis of most individuals that may have a knee replacement. Osteoarthritis is their diagnosis that is causing them to have to get a new knee or a new hip. So therein would be toilet risers so you can get up and down off the toilet easily, the cane, the walker, the four-wheeled walker that you can sit down on, as well as a variety of other things, bath aids in terms of stools that you can set in the shower.
Right.
Make it easier to get up and down.
With that in mind too, Mike, to what extent can we try before we buy when we come over to see you?
Everything that we have on our showroom floor, you're welcome to set on, kick, do whatever you want to do with. Unfortunately, with most of the personal hygiene products, you don't want those to go home and then come back. So
you'd rather have them just take it home.
And that's the difficulty. Some people just hit click and buy on the internet and end up with something that won't fit in their shower, won't fit on their toilet, and their surgeries tomorrow. So I encourage people to anticipate their need. You know you're going to have your surgery. Let's get everything gathered prior to the need.
Well, we hope we've given you a lot more information to try before you buy and shop smartly. And we're talking about the aids. And don't forget the medication part of the equation, but those aids to help you get around if you have osteoarthritis. And you can reach them at jayhawkpharmacy.com on the website. Mike and Paige Conlin and all your crew is fantastic. 235-9700 for that. And Mike, thank you for being on the show.
My pleasure. Thank you, Ralph.
HealthWise is hosting those monthly senior suppers at Stormont, Vail, the second Monday of every month now through November. It's $5 at 5:15 that night, and a speaker about a health and wellness topic of interest. And all you need to do is call that old Health Connections number. Remember that 354-5225 to make your reservation. Thanks again to Mike Conlin. That was awesome on osteoarthritis. Now let's get up and move around a little bit. Next up, we have our HealthWise TV exercise segment. Some fun and invigorating, some low-impact exercises. And be sure to check with your doctor before you start this or any exercise.